With that, I'm excited to welcome, I believe, yep, we're seeing the setup there happening up in Old Crow. So we do have Tracy Galloway presenting for us from the hub in Old Crow, and they'll be presenting on community advocacy with federal health programs, who's listening, and what do they need to hear. So a warm welcome for Tracy.
Good morning. The sound is good? Can you hear me okay at the other communities? Wonderful. Thanks very much. I am a researcher from the University of Toronto, and I've worked in the Yukon since 2014 when I approached the Health and Social Development Commission to do a small study of how federal health programs were actually experienced by Yukon First Nations. And the commission said, you know, you can't come and just do this for 3 communities. You have to do it for all 14. So since that time, I've been trying to learn all I can and make myself useful. But I'm really conscious of some of the comments yesterday and those of Chief Frost this morning, that research can be extractive, if not exploitative. So I'm really hoping that the WISPOR helps me be useful in this space. And if I'm not, I'm happy to retire from it and let people here lead the way, because I really think the good action comes locally. So I wanted to talk today about federal health programming. So all the communities receive funds from combinations of places, and those funding arrangements are really, really complex and diverse, and they differ in different communities. And I'm going to speak to that a little bit. But what I'm hoping is that the WISPOR can help communities advocate for pockets of funding that they don't already have. And I'll try and make clear what I mean by that. So my outline for my talk is that we're going to talk about who funds what. And then I'm going to try and give some tips from my experience about how to strategize to access federal funding, how to collect information that supports your request, how to package it up, and then how to go about advocating for greater access to federal health programs. Now, if you've worked in the North before, you'll know that it's a short form, heavy space. So the federal government has a short form for everything, and some of them are ridiculous. If you have not worked in the North before, these next 2 slides are going to be difficult for you, and you might want to go lie down. So there are funds available for Northern communities from Health Canada, from the Public Health Agency of Canada, which we tend to call PHAC or FAC. I'm going to call it Public Health Agency. From Indigenous Services Canada, which calls itself ISC. From Crown Indigenous Relations, which calls itself CERNAC. And from First Nations and Inuit Health Branch, which we tend to call FNIB for some reason. Okay. And then this is a horrible map of some of those pockets of funding and who's in charge of what. So I won't spend too much time on those little short forms in the North, but they refer to things many of you will recognize, like non-insured health benefits, Aboriginal Health Start on Reserve, and Aboriginal Health Start in urban and northern communities, Jordan's Principal funding, Substance Abuse Treatment Center funding, climate change funding, climate emergency funding, NNC, which is the focus of much of my research, the Nutrition North Canada subsidy. And on the right tend to be the basket of programs that are administered by Public Health Agency of Canada, things like Aboriginal Head Start for urban and northern communities, the Canadian Prenatal Nutrition Program, CAPC, which is early childhood funding, Healthy Early Years, some parenting programs and dental programs, and then the Aboriginal Diabetes Initiative. So funds from many of these initiatives are typically rolled into federal health transfers, but there are additional pockets of funds that are available through what's called grant model funding. You can apply. There are sometimes calls, but you can also advocate for your community to get access to some of these. And so I'm going to talk about how to do that. Lower down, you'll see the sort of chain of command where ISC, Indigenous Services Canada, and CERNAC are really responsible for all those programs on the left. And Public Health Agency of Canada is responsible for the programs on the right. And Indigenous services and CIRNAC tend to be very hierarchical, complex organizations, to say the least. And many of you have a lot of experience trying to navigate those big, big bureaucracies. I've put some little maps on here to show that, some of those are accessed through offices that are in Whitehorse, but there are intermediary offices in Gatineau, Quebec, and Ottawa for some reason. So it can be really hard to know who to talk to about those programs. Public Health Agency of Canada is a much more linear bureaucracy. So there really is an office in Whitehorse and then the office in Ottawa. And for quite a few of new initiatives, you can just talk to the Ottawa office, kind of skip the local one. And so I just like to point out that it's useful to talk to the top sometimes, especially when you're advocating for your community. So it's useful to reach out directly to Ottawa. And if you know there are connections between Public Health Agency and any of the ISC or CIRNAC administered funds, those are helpful too. So unlike ISC and CIRNAC, Public Health Agency is a really responsive, open, and high capacity group. And they're much more interested in innovation and creativity in program design and implementation. And so I've found a lot of success advocating with Public Health Agency. And I put as an example there that they're now involved in the reform of Nutrition North Canada, a program they don't oversee, but it's widely acknowledged that CIRNAC just doesn't have the capacity to do that redesign, and Public Health Agency is helping with it. So we can really think of them as being a doors open group with a lot of capacity. So in terms of being strategic, there are a few things that I've found have worked really well in the past. And one of them is to align with the program's mandate. So all federal programs have a mandate. The ministers in charge of them get a mandate letter, and they have a website that lists what they're supposed to be doing. And so I try and pick words out of that mandate when I'm designing information for them, and use their own words to describe why we need more services in community. So for example, I've used Public Health Agency's mandate. One of the things Public Health Agency is supposed to do is fund community-based organizations. It's supposed to fund intervention and prevention programs. That's really useful for us in terms of things like diabetes prevention, right? And it's supposed to strengthen capacity and increase support around healthy pregnancy and early childhood development. Right? So whenever we're communicating with Public Health Agency, we can just use their own words to say why it is we need more support from them. Okay. Another thing I often do is point out to the agency how, even though they're a federal agency and purport to serve all Canadian communities, they often don't. There are gaps. So if you can identify geographic gaps, communities in a region where they say they have programs but don't, that's often a really good way to get them to take a look at your community and see if they can add you to their list of funded projects, right? So a good example are the CAPC and CPNP projects in the Yukon. There are CPNP projects, really wonderful prenatal nutrition projects operating in Whitehorse and Dawson, but there's a really limited CPNP coverage in the rest of the communities. And the federal government might not be very aware of this, but you can point that out to them and demonstrate why it is your community needs that level of service, right? You can also, in addition to pointing out geographic gaps, you can point out other gaps in your community. So I often remind them that Indigenous communities have a really different age profile than other communities in Canada. So programs and services that are designed for early years support really need to be available in Indigenous communities like Yukon communities, right? So this is like 10 years old, this age structure graph, but it just shows the blue lines show the population structure, and they show that the smallest population groups in the general Canadian population are 15 and under. But in First Nations communities, of course, that's where most demographics are. So First Nations communities have loads and loads of young people, and they need services and supports for them and their families. The other thing you can do is demonstrate need. So a need can be defined in lots of ways. We can define need as something where no services exist. Oh, sorry, I spelled that wrong. I think having a PhD would prevent that. Doesn't. where demand really outstrips resources, or where you need a more coordinated approach. And the example I provide here is just a foot care program in Southern Ontario in Niagara region. There are lots of First Nation, Métis, and Inuit people, but there was no foot care program that had was designed with cultural sensitivity for those people. And so an organization advocated and secured federal funding for that foot care program. That organization was the Indigenous Diabetes Health Circle, and they now run all sorts of foot care supports and training for families. And they were really able to get those funds because there was such a gap. Let's take a drink here. So, how do you make the federal government agencies aware of these gaps? Well, you need to collect some information. And I hate to say this because you collect a lot of information all the time, but it's really useful to count things in order to demonstrate those gaps or those needs. So I always say collect both qualitative and quantitative information. So quantitative information is stuff you can count. You're doing it already anyway. How many people attend your programs? How many days do you offer them? How many years have you been offering? What does it cost? How much labor goes into planning for and carrying out those events? And I always say, do a pre and post survey. What did people think they were going to learn? And then what did they learn? What did people need? And what did you give them? So just do a little survey every time you do that. And that countable information is something that the federal government recognizes as data. What they recognize less, but I think is really effective in changing decision-making, is the kind of data that's been described here yesterday and today. It's adding qualitative data. And qualitative is narrative or story data. So when you're collecting qualitative data, don't just collect it from the participants of programs. Widen out to their family, but also other community members. How does it affect the community to know that you have really good supports for pregnant and breastfeeding mothers, for example? There'll be other people in the community who are aware of that and are grateful for that, and who are relieved of some of the burden that they feel on behalf of their extended family members if that program is there, right? So ask for their stories too. Keep it really open-ended, right? If you're implementing a breastfeeding support program, don't just ask about breastfeeding. Ask about how this affects other areas of their lives, because they're so closely interconnected. You all know that. By asking open-ended questions, you leave space for really unexpected outcomes or findings or changes. And, that's the good stuff, right? Implementing a breastfeeding program may help fathers in a family feel more confident about their ability to support their family, have better interaction time with their children. We don't know. So just keep it wide, keep the lens as wide as you can, and leave room for those unexpected outcomes. And I always say to leave time. So do the pre-post survey, but come back 3, 6, 9, 12 months later and ask people how they're feeling then, right? So sometimes change takes time, or it takes time for us to recognize the difference that it makes. So leave a lot of time for your story data, and include quotes and photos if people don't mind, because those can create a lot of impact. So I'll give an example. We did an evaluation of a program in Arviat, Nunavut, Southern Nunavut community, of their Young Hunters program. And this is an after-school program where elders would come to the school at the end of the class time, and then they would interact with children from the community, and they would teach them how to build and maintain their harvest equipment, how to navigate safely on the land and the water, how to harvest, how to butcher and manage their fish, every aspect of the harvesting process. So we collected quantitative, counted data about that. And we learned that over 1 year, the program served 18 youth from 15 families. They attended 2 days a week for 3 months, in January to March. We did some short surveys that showed kids had better knowledge after the program than before, and that knowledge was about things like how to build and maintain their equipment, how to find routes, how to operate safely on the land, right? The story data, though, was a lot richer, right? So when we reached out to folks the young people themselves said that they thought it was fun to be on the land, and they really enjoyed spending time with elders. And that wasn't something many of them had been doing before. 6 months on, more than half of the youth continued to harvest for their families and provide food in the community. And that, we were able to see what animals they were able to harvest pretty independently. So they were smaller things like geese and ptarmigan. Parents described big changes in attitude and happiness among their kids. So we included a quote: "He's much happier and he tries to help in any way he can." And then parents also reported that the youth were sharing with each other more often. They expressed more willingness to help out. They seemed happier and more thoughtful, right? And these were not questions we would have asked specifically, but by just asking open-ended questions, do you notice any changes in your child? Parents told us a whole range of things that really spoke to us about children's self-esteem, their confidence, and their role as young Indigenous people in the community. All right, so how do you package this up in a way that federal agency staff can recognize it and use it to help make a decision? So I tend to use something called a briefing note, just a one-pager. People don't have time for anything, and people don't read. And so the shorter you can make this, and really if you can get your whole story out in just 2 or 3 lines, that might be all the person at the other end of an email chain reads. So you have to make it pretty heavy hitting, summarize things, and get them out there in a short, neat package, right? Some tips I use are to always provide a map, because nobody knows where anything is. And if you work in Ottawa for a while, that problem gets worse because federal agency employees are rarely allowed to travel. Right? Tend to pair counted data with story data. I think it makes it really impactful to have a quote here and there. Tend to try and make it visually appealing. So use pictures, use colors. What I use is the newsletter option on Word. Just as a way to get some color and different font and make it visually appealing. And I try and always list some asset that the community has. And it may be a partnership with a community that already has that program so that they can learn from them. It may be that they've built a facility locally, so you have a good space for it, but list what capacities the community has. So I've got an example, and this is a fictitious briefing note for a nation in Northern Ontario advocating for an Aboriginal Head Start program. So I'll just walk through it. I think I've forgotten a map on this one. My internet was a little poor until I arrived. So you can see that I've used lots of bright colors. I've made the first couple lines the whole point. Anybody who read the title would know what we wanted. We want Sandy Lake First Nation to have an Aboriginal Head Start program. And we know who funds that. So Aboriginal Head Start for this community, because it doesn't have a final and self-government agreement, would have to be through the on-reserve stream of ISK. And so that's who we would email with this document, right? I've put the First Nation logo on there because it's nice and bright and cheerful. I've got our goal right up front, right? We want a sustainable funding source for this program. I've got some key messages on there, right? Most of these people won't have been there before, so I really should have a map beside that just to show them where Sandy Lake is, that it's fly-in only, that 13% of the population are 4 years and younger, and that compares to 5% in the rest of Canada. So obviously there's a big need for early childhood supports here. And that there are no Aboriginal Head Start programs north of Sioux Lookout, Thunder Bay area. In the 29 remote First Nations, there are no Aboriginal Head Start programs funded by the on-reserve funding unit at ISK. So I'm pointing out an inequity, a geographic gap. Okay. And then I just provide a little bit of backstory, right? This community may have built a brand new daycare, and I show a picture of it above, and it's really beautiful. And they're operating it and they're paying for the program themselves. It's costing the community $21,000 a year, and still they can't attract and retain staff who are qualified, right? And then I've also put that they want to have a traditional meal and snack program, right? So I'm making really clear what the ask is. We're using our own funds for this, which is taking away from other things that we can fund. You have a program that funds exactly this. We have a lot of capacity. We have elders volunteering, teaching language, teaching culture in the program, and we just want to make that sustainable and add a meal and a snack. It's not a huge ask for a program that already exists, right? And then I've got a nice picture and a quote and the contact information for who they should talk to, right? And try and bring in some heavy hitters there, right? Like there should be one person doing the messaging all the time, but it's good to have an elder, a counselor, a deputy chief, or a chief on the contacts, right? You want the person in Ottawa to recognize they're dealing with someone who's got the authority to make this happen. So finally, you've packaged this information all up. Just a few other tips. Choose a single messenger, right? The person who's always going to be emailing and phoning should be the same person all the time. And that's because you're trying to change this from a phone and computer-based exchange to a person-to-person exchange. Hi, this is Tracy Galloway calling for Jillian Booth. Is Jillian in? No? Could you let her know that Tracy called again, right? It's Tracy and Jillian communicating. I always use email and phone. If you send an email, you may not get a response. So send the email and then follow up in a couple days with a phone. Repeat the emails, repeat the phone calls. You guys know this. I know lots of you live this. Follow the path. So if Jillian transfers me on to Sharon, now it's Tracy trying to reach Sharon, right? Go wherever you're directed, because these are big bureaucratic organizations, but try and find that other person who's going to talk to you consistently about this possibility and be persistent. Okay. So, I put some of the contacts here. All these agencies have, again, they have a northern office, but they have an office in Ottawa. And sometimes for something new, I find it really helpful to go to Ottawa. The local agency in Whitehorse, in Elijah Smith, they're just going to have to ask folks in Ottawa anyway. So advocate with Ottawa. Remember, the government works for you. That's a point Chief Frost made this morning. Can feel like it's the other way around a lot of the time, but they actually work for you, for us. So ask them to do the job they're paid to do and communicate with you. Okay? So here's a few contacts for Health Canada, FNIB, NIHB, for CERNAC, and for Public Health Agency of Canada. Some of them have very specific contacts. And then like I had said earlier, there are strange bureaucracies, like a lot of FNIB's programs are managed out of Gatineau, Quebec. So know that and just make sure you're calling the right office for the program that you want, right? CERNAC has a Whitehorse office, but I would try the Ottawa phone number and email. And then Public Health Agency, you may have to go program by program. So there's the Aboriginal Head Start for urban and northern communities. If you're a community that has a final and self-government agreement, that's the office for you. I'll put another one on here for the on-reserve communities. If you don't have a final agreement, that's the office for you. And then I'll give this slide deck to the WISPOR folks, and maybe they can circulate it with you if you find it useful at all. I did think that WISPOR might be particularly useful helping do this work for a couple of these steps. So I know that like folks like Lyris know very well who funds what. They have long experience working in this area. So you can contact the WISPOR for some of that information. And then these folks absolutely know how to collect and package info for purposes like this, right? Part of the responsibility of research agencies is to build an evidence base that informs advocacy. So, reach out. That's all. Thank you very much.
Fantastic presentation, Tracy. Thank you. I think we do have a few moments for any questions, if there are any in the room or online. You don't have to come up here. I'll bring you a mic. Are we all good? Any questions online, Stephanie? No? All right. Well, thank you very much, Tracy. I think super informative. Always trying to find funding is an issue, and so I think lots of great information trying to move through that path. Thank you for your time and information.